Hello, my name is Dr. Robert Findling. I am the Director of the Division of Child and Adolescent Psychiatry at University Hospital's Case Medical Center, and I'm a Professor of Psychiatry and Pediatrics at Case Western Reserve University. Now today, in this posting, I'll be talking about an important topic, cognitive behavioral therapy, and there is new information about cognitive behavioral therapy, or CBT, in the treatment of adolescents suffering from depression. And that's really what we're going to focus upon. Now in this blog, I'll be considering the results of an NIMH-supported study that was entitled Treatment of SSRI Resistant Depression in Adolescents, for short, Toria. Now results of, or the primary results of the Toria study were published in this year's Journal of the American Medical Association. Now the rationale for Toria is actually kind of compelling, and it's based on a couple of key principles. First, cognitive behavioral therapy really has potential benefit, and this has been demonstrated in the treatment of adolescent depression across many studies. It is an effective intervention that has been repeatedly demonstrated. In addition, a lot of teenagers receive treatment with SSRI antidepressants. However, the research data consistently demonstrates that a substantial number of these young people who are treated with SSRIs with depression do not adequately respond to an SSRI as part of their pharmacotherapy. So the purpose of the Toria study really was to examine how best to address the needs of these young people, these teenagers who are suffering from major depression, who do not respond to SSRIs. As you all know, depression can be a devastating illness associated with substantial morbidity and human suffering, and certainly carries with it the risk of suicide as well. So certainly this is a malignant condition that really deserves effective and safe treatments. Now, as part of the Toria study, Brent and colleagues took 334 teenagers who were not responsive to SSRI therapy, and these youngsters were then subsequently randomized to 12 weeks of treatment in equal numbers across 4 different treatment groups. And I want to point out what those 4 groups are. In the first group, one set of youngsters received treatment with a different SSRI. In another group, the youngsters not only had their SSRI switched, but they also had cognitive behavioral therapy added to their regimen. A third group of youngsters had their SSRI discontinued and were begun with treatment with venlafaxine. And then finally, the fourth group not only received venlafaxine, but in fact venlafaxine and in combination with cognitive behavioral therapy. The key findings from this study was that the authors noted that the patients who received cognitive behavioral therapy, and there were 2 groups who did so, had greater response rates than those who received a medication switch alone. Moreover, it didn't matter which medicine the youngsters were switched to. The youngsters who received an SSRI or a different SSRI did equally well when compared to those who received a switch to venlafaxine. So in short, this is yet another paper that highlights and demonstrates that CBT in this patient population, teenagers suffering from depression, can be a really important treatment intervention. Now, of course, when considering and performing any study or treating any youngster with depression, safety in general and suicidality in particular are key considerations because self-harm really is a risk in this patient population. In the Toria study, there were no completed suicides, and there were no statistically significant differences between any of the 4 treatment groups when relating to the frequency of self-harm. So again, to summarize, I think the most important aspects of this study is that it demonstrates the important role that cognitive behavioral therapy, or CBT, can have in the treatment of teenagers suffering from major depression. Now, for those of you who are interested in reading this paper directly, the results of this study, to which I've alluded in this blog, were published in the February 27th issue of the Journal of the American Medical Association, or informally JAMA. Now please feel free to comment on what I've been talking about today by clicking on the Discuss Link button located beneath this video screen. I'm Dr. Robert Findling, and thank you for watching.